As far as this vignette, we'd be very concerned that client appears socially isolated because her son walks in and she's so eager to have somebody to talk to. It's poignant in that she's been waiting all day, apparently by herself. The poor client is sort of starved for that human contact.
She is completely helpless and dependent, and there's no one in her world but this son. And so I think it's experienced as the deepest kind of betrayal that the person on whom she depends for everything is so angry at her and has made her feel like she's a no count, that she can do nothing. And she's terrified of him, and she's kind of grief-stricken that she's failed him.
I was curious as to who else could have been involved, may have been involved, is no longer involved. Are there any other family members? Are there any losses? Where is his father? How recently did he leave the household, and under what terms? And try to expand that orbit that they have, because right now that orbit is much too circumscribed. It's just the two of them.
And I think it's an added stress when the person that you're caring for is your mother, because the idea is that your parents take care of you.
In assessing the needs of the mother, it's obvious from the video that she has some degree of memory impairment. She's not sure if the son is just coming home from work, if he's going to work, but she's also highly stressed and highly anxious.
And people should realize, which I think most people do, is that having a cognitive impairment and having severe memory loss doesn't mean you don't have feelings, and that you can't be sad and you can't be traumatized, and you can't experience joy and relief also, and happiness. And I think for her, all of the joy and the happiness and even the relief have been leached out of her life, leaving her with nothing but terror and sadness and isolation in it.
In that regard, not everybody should be a caregiver, whether he's drinking, whether he's depressed, or whether he simply has work-related stress. He's not in a very good position to take care of his mother, and it looks like he's taken on a whole lot. He's kind of cracking under the stress, really.
When you look at a video like this and you see that this is a man under tremendous stress and an aging mother with clearly poor memory, and the thing about capacity is it's very task-specific, so that in our role as psychiatrists evaluating elder abuse, we have to know what specific, or we look at what specific task a person's capacity is being assessed in order to find out if they have capacity to do that one thing. So that just because you have cognitive impairment, or just because you are demented and have Alzheimer's dementia or vascular dementia, doesn't mean you can't do anything at all, that you can't make any decisions.
Yeah, a great example is she knows very clearly that she does not want to be in a nursing home. So at least that's her statement, and she would take an alternative to that, and I think she probably has capacity to make that decision.
Right, and she clearly knew that she had prescriptions that needed to be filled, and that there's medicine she needed to take. So she, we know that there are pockets of functioning very well left intact, or at least well enough for her. So we would, if she said, I don't want any help in the home, I just want my son and nobody else, that would be something that perhaps we would be asking, does she have capacity to make that decision? And we would have to look and see, what is the question that is being asked, and does she understand the risks and benefits of her approach versus the risks and benefits of what a professional is suggesting, and then we take it from there.
Yeah, it's a kind of sliding scale depending upon the importance of the consequences. If she said, I want no care whatsoever, that would be a different capacity evaluation altogether.
But, it seems most likely that as time progresses, she will have less and less ability to make decisions, although we can't assume that. So one of the things that, while she still does seem somewhat intact, the more information we could get about her wishes now, the better. So naming a healthcare proxy, or making a decision about if and when, you know, she's in a medical hospital, what things she would want done for her. You know, about making a will now, things like that, that don't necessarily factor into the issues we saw in the video, but would lead one to believe that the more of her affairs she could get in order now.
But going back to the son, we would encourage the assigned worker to do a clinical assessment of the son, but also to engage him in order to see if he would be willing to accept services on his own behalf, whether we provide the services or we refer him to another provider. Our goal would be that SMOP would be able to continue to service their mental health needs in the household.